Dear friends, today let us talk about something that is not so well known but that affects our vision and lives a lot. And that condition of the eye is known as age related macular degeneration or ARMD. Now, what is ARMD? ARMD, as is well known as is obvious from the name, affects the macula of the eye, which is the most sensitive part of the human retina responsible for the central vision. Now, this is an important cause of visual impairment in the adults and the elderly. It is estimated that over 5% of global blindness is because of this disease. So it's mainly a disease of the older population and its incidence increases with age, predominantly of two types, dry ARMD and wet ARMD. The dry type is by far the more common. Approximately 90% of the patients have dry type. This is a slow progressing disease causing defects in the central vision over a period of many years. The patients may experience distortion in their central vision, difficulty in reading and recognizing faces, and this condition worsens over years. There is no definitive treatment, but research suggests the role of certain vitamins like lutein and zeaxanthin, which are found in green leafy vegetables and can also be prescribed in the form of a pill. Now let's come to wet ARMD. In a minority of the ARMD patients, a more severe and more visually devastating form of ARMD will occur. It occurs in comparatively younger patients and progresses much faster. New blood vessels form under the macula and they bleed and they scar. Patients see central scotomas, that is black or empty spots in the central vision, and the loss of vision is profound and intense and dense if untreated. Fortunately, there is now some treatment available if this disease is diagnosed in time. Over the past decade, the treatment has become available. There are certain drugs known as anti-VEGFs which are now available, which can be injected inside the eye, and they cause regression of these unwanted new vessels, and vision can be preserved and even restored to some extent. And here lies the importance of regular eye checkups with an ophthalmologist at least once a year. Many times your eye specialist will raise a red flag if he suspects ARMD and advise you for certain tests like OCT to make sure. OCT is a test which magnifies your macula many times so that we can see minute changes in the macula of the eye. Sometimes the patients will get symptoms like distortion of central vision, straight lines appearing wavy, etc. In case anyone gets such symptoms, please check with your ophthalmologist pronto as soon as possible. The bottom line is wet ARMD is dangerous, but now it is treatable to a large extent. Some more useful information to give to you before I conclude this talk. ARMD has both hereditary and environmental causes. Hereditary we cannot change at present, maybe later on may be able to, but environmental we can. Smoking is a well-known risk factor, so a big no to smoking. Obesity is also a risk factor, so regular exercise and a healthy diet rich in fruits and green leafy vegetables is a big yes. Just a final word. There are many diseases in the body which are silent and do the deadly work quietly. Ditto for the eyes. Glaucoma and ARMD are the two scary ones. So keep your doctor in sight so that you can keep these demons at bay. Thanks and have a healthy life and a great vision. Goodbye.